Hi, this is Dr. Michael Bandman here, and I'm just going to go over, for those of you that have been referred to our office by other people who have received care with us, we've designed and developed this video just to help you get a little bit of a better understanding about what regenerative medicine is, which includes more than just stem cells, and how it can be helpful for you. In order to understand those stem cells, it's really important to go back and figure out what your plan is for your health. So a lot of times we've allowed our bodies to just degenerate over time. Regenerative medicine is actually the opposite of what we've allowed our bodies to do. So if we look, for example, at this knee here, it's completely degenerated. The bones are squished together. If we look at this finger, they've started to change and deform. That's called degenerative arthritis. And there used to be no real way to stop that because we didn't have the science available, we didn't have the tools available to us to understand how, in particular, these regenerative treatments could benefit people. But for the past, since the 1970s, we've been gathering bodies of information. I actually have a book that has about 800 studies for different conditions that regenerative medicine is actually going to help. And the whole concept is, if we think of a lizard, when its tail gets cut off, it actually regenerates something that's not even there. It will regenerate a new tail, and that tail will come from tissue that doesn't exist at that point. But the brain of the lizard has the ability to make a whole new tail. So when we talk about things like degenerative arthritis in the knees, we're looking for the body, the brain, the body's innate ability to heal, to reconnect, generate cartilage, bone, tendons, the synovial fluid, all the things that go along with that joint. And the treatments, the injections that we give will actually help people do that. So people will experience relief from pain, but you can actually have a degenerated condition or a degenerative condition and not feel any pain. Our concern more is that we get the body to heal the way it was designed to heal. So regenerative functions in your body will come from different things in your life. Probably if you eat healthier food, your regenerative capacity will be higher. If you take supplements and exercise, you can do infusions, which is I'll talk a little bit more about. And then things like how your brain communicates through your spine will help you regenerate tissue cells better and at a higher capacity. And then we get into the interventions now that are becoming more popular, like PRP and some stem cell products. The first way that we help people in our office is by giving them regenerative infusions through different nutrients through an IV process. Our nurse practitioner would work with that person to develop a plan, and they could do things such as vitamin C, they can do glutathione, they can do acetylcysteine infusions, which don't take a lot of time in the office, but they actually help the cells that you presently have become work at their highest level. They work to stimulate and help those cells grow and get the nutrition, the nutrients that they need if they're lacking anything. Another way to quickly heal a joint is through PRP. This works well with trigger points. It works well with joint injections, but this is where we draw your own personal blood and we spin it with a centrifuge, and it creates this yellow substance that you see here called Platelet Rich Plasma, and we can re-inject that into a joint to help your body heal anywhere from 3 to 7 times faster than it normally would. And we've seen some pretty amazing results just with the PRP. For the most part, we would use that with someone who is a little bit younger. So under 20, it's going to work amazingly. Under 40, it's still going to continue to work. When we start to get over 40, then we're going to start to talk more about getting something like a Wharton's jelly product in. A Wharton's jelly product comes from the tissue in the umbilical cord from a live birth, not from an aborted fetus, not from a birth that's not viable, but from a live, healthy birth. We extract the Wharton's jelly in the lab, and we use that because it's full of cytokines, which are the skeletal structures for new cells. It's full of fibrinogen, immune-fighting properties. It's full of hyaluronic acid, And then there's over 300 to 400 growth factors that are going to help your body heal. And maybe the most important thing that is contained in the Wharton's jelly is the anti-inflammatory properties. We know someone personally who their son had a major accident and their spine got really inflamed. They were told that they needed spinal surgery or they could be paralyzed. And the son actually decided, he's in his 20s, he decided that he would not do surgery, but instead he would get anti-inflammatory regenerative product injected into his spine. And within 16 to 24 hours, the swelling in his spine completely went down, and he's now up and walking again about three weeks later. So there's some amazing things that these things will do. In our office, we inject this Wharton's jelly for arthritic joint conditions, pain and dysfunction, trauma that's occurred in a joint. And we also would inject it. A lot of people inject it in trigger points. So the reason they would inject this is to get back function that they've lost, is to recover things that they never thought they could recover. This Wharton's jelly has an amazing amount of healing connection to the body. The cells that are stem cells that may be contained in the Wharton's jelly are like signaling cells, and they would go up to the brain and they would tell the body where to heal, what specific tissue to heal, and where in that whole joint or that area that ADP, ATP, oxygen, all these things that are needed, that they could donate energy to the healing process of the body. And by energy, I mean chemicals, growth factors, oxygen, those kind of things. Regenerative medicine and the whole point of it is to actually decrease inflammation and the scar tissue that's built up in a degenerated joint or in a traumatized joint. Then it's to help regenerate new tissue that can be, if you look down in the corner here, can be connective tissue like bones, cartilage, tendons, muscles, the things that support and surround and protect those joints. And then the fourth thing that a stem cell, a mesenchymal stem cell will do is it will actually help modulate your immune system. So it's pretty amazing, but we get our product produced for us from an FDA compliant lab that has a high quality control division. Our lab has 60 people working full-time in the quality control division, because we feel like when we chose a lab that we would want the highest quality standards for us. We want to assure that it's not from something that ethically we're against, like embryonic tissue, aborted fetuses. And we want to make sure that they have a history that's proven. And maybe one of the most important things is the viability of the product. A lot of things have come into question lately about stem cells and whether they're actually alive when they get injected. Our lab has been independently studied by the International Society for Cellular Therapy, which actually determines what a stem cell is. And they created this chart for us to show you. When we look here at umbilical cord matrix, that's the Wharton's jelly product. It checks off the most boxes out of all the regenerative products that we see up here. So we go all the way from drugs all the way to adipose tissue. And we see here is from a biologically young source, which is really important. And the viability of the cells is the highest according to this independent testing in the Wharton's jelly. You want the most viable cells going into the joint or into the area of concern, whether it's a muscle or a tendon or a ligament. We want the most viability from the cells that we're injecting in so that they can do the most work to help you heal. And we're seeing amazing results. I personally have had regenerative procedures done to me because I tore up, my whole knee joint was torn apart. I tore 3 ligaments, both my meniscus, and muscles in the back of my leg, also some connective tissue in the front. And I have had this Wharton's jelly injected into my knee to help it heal. the next step for people is to actually there's not a one size fits all treatment for everyone. So the next step for people is to actually get an exam or take a medical history, and that's from our perspective dependent on trauma and how much arthritis has built up, how much pain and dysfunction someone has. And then also it has a lot to do with the age, because your stem cells, when you're born, are way more active in the healing process for the first 20 years of your life. They heal you, they help restore and regenerate new cells. And so as you age, your stem cells deplete inside of your body. They're still there, but they deplete, and that tells you why you don't heal the same way that you did when you were younger, because your stem cells have become less and less over time. But we would love to help you. Probably you've been referred by someone and they wanted to give you more information. That's why they directed you to this little talk that I wanted to help people with. But you can schedule an exam or consultation over the phone if you're outside of the Phoenix area. We have done this a lot. We've done over 500 different injections in the past 5 to 6 months. For patients like you from all over North America have come to our office. They fly in and they get injected, and then they leave once we've developed a good care plan, seen all their medical history, seen their tests. We do tests in the office. We do injections under guidance of ultrasound here in the office. And if you have any questions, we'd love for you to call us. I'd love to personally talk to you. My number at the office is 480-842-8787. And if you mention the code, we have a referral code because we really love to take care of our community. We love to help the people who've been helped. And they have reached out to you because they have got such great results and they care about you. So if you mention that code, aligned19, we will give you a bonus for your care. So I'd love to hear from you, and I hope you have a great day. If you have any questions, you can leave them below or leave any comments you have below. Otherwise, we'll talk to you soon.